Good, happy Wednesday morning, October 21st, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Wednesday morning, so let's begin. But first, we're going to begin with COVID-19 updates. 85 new COVID-19 cases, 2 new hospitalizations reported in New Hampshire. Let's take a listen to that video from WMUR News 9.
Chapel Tractor has been in our family since 1955, when great-grandfather Pearlie and our grandfather George decided to...
Tonight, New Hampshire is seeing a drastic drop in active COVID-19 cases, down to 824 from more than 1,000 yesterday. Good evening, I'm Monica Hernandez.
And I'm Tom Griffith. Today was also the first day in a whole week that state health officials reported no new coronavirus-related deaths. There are, however, 85 new confirmed cases, including 11 children, and 16 people are hospitalized.
Okay, and there you go on that video and that report. Coronavirus in New Hampshire, important information and latest graphs. Let's take a look at that right now. And here is a look at COVID-19 in New Hampshire. There are 9,882,28 number of people in New Hampshire have tested positive for COVID-19. 8,260,459 number of people in the United States have tested positive. 468 number of deaths from COVID-19 in New Hampshire. 763 number of people who have been hospitalized with COVID-19 in New Hampshire. And 220,092 number of deaths from COVID-19 in the United States. And now let's take a look at this map of New Hampshire, where current cases of COVID-19 are. In Nashua, 112. And let's take a look at this map of New Hampshire, where total cases of COVID-19 are. In Nashua, 1115. And now let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalization. And in the red, deaths. Let's take a look at this chart here. Current cases. In the purple, total current COVID-19 cases. And in the orange, current hospitalization. Let's take a look at this chart here. Total cases. In the purple, total positive COVID-19 cases. In the orange, total hospitalization. Red, deaths, and blue, recovered. Now let's take a look at this chart here. Positive PCR test rate and daily PCR tests. And now let's take a look at this chart here. Age group of cases, female and male of cases, and risk information. And let's take a look at this chart here. Infections, hospitalizations, and deaths. And let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Shaheen Mesner debate pandemic response, foreign policy in U.S. Senate debate. Shaheen seeking third term in office. President Trump backed Mesner during primary season. Let's take a listen to that video from WMUR News 9, Charisse Leclerc.
two candidates dealt some blows we've seen out on the campaign trail.
My opponent is not from New Hampshire. He doesn't know me. He doesn't know my record.
She's been there too long. She follows Chuck Schumer. She follows Nancy Pelosi.
A point of contention, the ongoing negotiations in the Senate, with Messner attacking Shaheen over partisanship, over the stalemate between Democrats and Republicans in working out a stimulus package for Americans.
That's why we need new leadership in the Senate. This idea of allowing people to suffer for 6 weeks, because of inside the Beltway negotiations and holding out while people in New Hampshire are suffering.
The bill that Mitch McConnell put on the floor at the end of July doesn't provide the help that people need.
Shaheen painting the picture to voters that Messner would be an extension of President Trump's handling of the virus.
This is Donald Trump's America that we're in, where we've seen 8 million people who have contacted the coronavirus. We've seen 220,000 deaths nationally. This president continues to take a blasé approach, and my opponent's going to be with him without wearing a mask.
The institutions of government did not learn from the H1N1 pandemic in 2010.
Now, if you missed any part of tonight's debate, you can catch that on any of our digital platforms. Live in Manchester tonight, I'm Charisse LeClaire, WMUR News 9.
Okay, and there you go on that video and that report. Merrimack County has high rate of COVID-19 infections. Health officials say small gatherings of family, friends drive new cases. Let's take a listen to that video from WMUR News 9, Amy Cavino.
For over 85 years and 4 generations, award-winning Palmer Gas and Oil has been serving communities throughout New Hampshire, northern Massachusetts.
At this point in time, the grid shows hybrid for us, so I feel good about where we're at and the fact that we're back in school.
The grid the superintendent referred to is a decision-making matrix provided by the Department of Health and Human Services to help school officials make the call to go remote or not.
In general, the trend that we're seeing in schools is that there is not a lot of transmission happening in schools, and that's largely because a lot of those prevention measures that were put in place as part of the reopening.
Everyone has that responsibility, right? The government can put out mandates, the government can make testing available, we can do all of these things, but at the end of the day, each of us as individuals has that responsibility of wearing our mask, maintaining the social distancing, washing our hands.
So if it's not happening in school, where is the infectious spread coming from? Turns out, the people you love and trust the most.
We know a lot of people, when they get together with their friends and family, they're not going to plan to wear masks or to social distance, but that's the most important time because the transmission that we're seeing are in these small groups and events.
Health officials predicted a surge in the fall and say it could be much worse, but preventative measures in place are keeping the numbers manageable for now. The superintendent says transparency is the key to success.
People are nervous. This is, uncertain times for all of us. But I think that positive communication and communication in general is what people respect.
The superintendent says he keeps a close eye on the COVID outbreak map and says HHS has been a huge help to the district when it comes to contact tracing. In Franklin, Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. White House testing Kazar encourages Granite Staters to continue getting tested. Met with Governor Sununu on Tuesday. Let's take a listen to that video from WMUR News 9, Mike Cronin.
Chapel Tractor has been in our family since 1955, when great-grandfather Pearlie and our grandfather George decided to sell tractors.
White House coronavirus testing czar Admiral Brett Giroir has a message for all Granite Staters and Americans.
Don't give up on the testing right now because it's a really, really important component.
He says COVID fatigue has definitely set in, but that people can't take this virus for granted.
You can feel completely normal but still have a high virus and spread it to other people.
The Admiral and other officials from U.S. Health and Human Services met with Governor Sununu today in Concord to announce a $25 million initiative aimed at fighting Lyme and other tick-borne diseases. Now, during that visit, Gerard said the country is testing more than 1 million people a day, but has capacity to do much more. He didn't know how much the Trump administration has spent on testing, but says whenever there's new technology, they'll pursue it. That includes the rapid cart-based testing kits, which he believes could be widely distributed to American homes a few months down the road.
There's two issues about home-based testing. Number one is there hasn't been a home-based test developed that really works very well yet.
The other issue is availability.
Right now, we're supplying about a third of those to protect the vulnerable in nursing homes, assisted living, home health care, hospice, HBCUs.
Gerard is confident a possible game changer could soon be on the way.
We are on the pathway for a vaccine. We are very cautiously optimistic. When that vaccine is available, safe and effective, we will have tens of millions of doses.
As to when, the Admiral is hopeful that a vaccine will be ready by the end of the year. In Concord, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. Some New Hampshire schools conduct own contact tracing investigation of COVID-19 cases. Investigation let officials know how infectious spread. Let's take a listen to that video from WMUR News. Sorry about that. Let's take a listen to that video from WMUR News 9, Tim Cowrie. Sorry about that. I have allergies this morning.
Contact tracing can tell us a lot about how COVID-19 is spreading in our communities, says Beth Daly, New Hampshire's chief of the Bureau of Infectious Disease Control.
Where we are seeing transmission occur and that we think is contributing to this increase in community transmission is those social gatherings that people are having either with close friends or families.
Those gatherings and out-of-school activities can lead to cases inside the classroom. And some districts, like Bow, are doing their own contact tracing.
From there, our school nurse, gathers the information from DHHS, and we start the process.
Seating charts and schedules are checked to see who may be impacted.
And then you just kind of drill down from there as you have conversations with people. We may be able to use the video camera for some common areas.
Parents and guardians are then notified. The district says it's easier to do contact tracing itself rather than leaving it to the state.
We have the relationships with the parents, and we can also answer specific questions they have about programming and specific questions about what our local policy is as we go forward.
Ultimately, that job of doing that contact tracing is ours, but there's certainly a partner in that, and they can play a really critical role in being able to respond very quickly in their communities to any potential cases.
And school officials recommend keeping a log of your children's activities outside of school, something that could be quickly referenced should you receive a phone call during the contact tracing process. Reporting in Bow, I'm Tim Cowrie, WMUR News 9.
Okay, and there you go on that video and that report. Manchester aldermen vote 8-5 against city mask ordinance. Did approve rule requiring mask inside city-owned buildings. Let's take a listen to that video from WMUR News 9.
In times like these, we're all spending more time with family and more time working our land.
And breaking tonight, a proposed mask mandate for Manchester is dead. Within the last half hour, the Board of Aldermen voted 8-5 against the ordinance. It would have required people to wear face coverings inside any public or government building. But the proposed $1,000 fine was stripped from the proposal. Aldermen did approve a rule requiring masks when inside city-owned buildings only.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.